right here because we're going to be looking into men's health. That is something that we do not hear enough about with insulin resistance is men's health. Now, a little bit about me is I'm a testicular cancer survivor. So that's huge. And when it comes to insulin resistance, that's an important part that we don't talk about enough because low testosterone is an insulin resistance sign. And today we've got Lindsay Venn, who's going to be jumping in here talking about this very issue. And I'm excited about that. So if you guys want to stick around here, you're going to get some great information as we go into this. And I'm really looking forward to this and what we're about to learn from Lindsay and Trent.
Men's health in this case, and one of the best medical professionals in the world, one of the top experts in the world, is Lindsay Venn. Lindsay has helped us on previous calls. I love when Lindsay is willing to come on the call because she takes me to school and I learned so much from Lindsay. Lindsay is one of the founding members for the Metabolic Society of Healthcare Practitioners. She is a big part of Insulin IQ, and Insulin IQ and Lindsay work with the absolute best of the best when it comes to insulin resistance. They work with Dr. Ben Bickman. They do lots of different research, and Lindsay spends her days helping people get off their medications and stay out of the hospital whenever possible. So Lindsay has been invited today to talk about insulin resistance and men's health, and she'll be our guest speaker. Lindsay, are you prepared? Sorry, I'm a little early to you. Does that work for you?
I am prepared. I will share my screen and we will move forward and go from there. So give me 2 seconds to upload this. And we'll do my little normal PowerPoint presentation on what we're going to talk about today, which is men's health, which is near and dear to my heart, just as much as women's health. And where insulin plays a role, like Trent mentioned early on, that insulin is the root cause of so many problems in general health and chronic disease. And we're going to focus a little bit more today on what happens to men and where insulin can be the culprit. So Trent had mentioned erectile dysfunction for sure. That is a men's health concern, definitely. But some other things when I think of men's health are these things listed here. Things like your testosterone levels. How's your prostate? Where is your weight being carried and do you have too much of it? How's your energy and your stamina, general health, heart health? Do you have insulin resistance or type 2 diabetes? All of these things play a very important role, especially as men age, in how they do long term. And so I do point out there are a lot of factors to play when it comes to this. I like to focus on the ones that we have the control over. So things like diet, for example, our career, our lifestyle, our family support, where we live, those things we might have a little control of. Things like genetics, maybe not so much. But we're going to focus today particularly on diet and the Feel Great system and how we can improve overall men's general health as well as those factors that I listed. So, but to begin, Trent touched on it a little bit, but what is insulin resistance? I think it's really important to understand how this works. So insulin is a hormone or a peptide that the body produces in response to being fed. Every time we eat something, we're going to have a raise in insulin. And insulin's number one job is to dictate where that energy goes. The energy that we put in our mouth,
Right.
Where is it going to go in the long run? So this is a cell. Every cell in the body requires insulin in order to get glucose into the cell. And I'm going to use glucose and energy interchangeably because they're the same thing. Glucose is the primary fuel source for our cells. So energy is a term that I like to use. So when we eat something, we secrete insulin. Insulin from our pancreas enters into the bloodstream, and then it will go launch or put itself into this receptor site. And when it does that, that receptor site triggers this opening of this door. I'm going to use simple terms here. This opening of this door to allow glucose to get into the cell. Remember, this is the gas. This is the fuel that the cell needs. In someone with insulin resistance, this receptor site's broken.
Right.
We actually don't have the benefit of insulin inserting itself into that receptor site because this doorway is blocked. It's not open and glucose cannot get in. And what happens here now is we don't have any energy in our cell. And our cell, just like our car, won't run if it doesn't have any fuel. I oftentimes will liken this to a lock and a key. If you want to think about your insulin receptor site as a lock on a door and this glucose transport mechanism as the actual door, if the lock is broken,
This is great.
the door
This is
cannot
really
be
good.
opened. And insulin resistance is a broken lock. You can have as many keys out there as you can imagine. If the lock itself is broken, the keys won't work. And we'll keep making more and more and more keys until we find one that works. And that is what insulin resistance is. Lots and lots of insulin, but yet no fuel, no energy into our cells. And therefore the cells can't function properly. Another way to look at this is with this slide where we have
This is
somebody
good.
who's got normal insulin metabolism. They've got normal levels of glucose. They have this key over here that's going to fit directly into this lock perfectly. And we're going to have
Right.
adequate fuel for the cell to function properly. In someone with insulin resistance, we
Right.
have a couple of things that happen. We get high blood sugar levels. Oftentimes, that's a later result, but it happens. This key doesn't fit into this lock because, again, the lock is broken. And now we have deficient fuel inside of our cell, so it cannot function properly. Why is this a problem? Well, when we look into men's health, there's a lot of
Right.
factors that
This is what
play
you pay
a
attention
role.
to. Men's health.
I love
This
this
is
slide
key.
because it really shows that this is a cyclic problem.
Wow.
One thing can lead to another, but yet the same thing can lead back to the other. The primary example here is low testosterone can create insulin resistance, or like they say here, metabolic syndrome, type 2 diabetes. But also in reverse,
Wow, I had
type
no
2
idea.
diabetes, insulin resistance can lead to low testosterone. Obesity also plays a role in this, as we know, because obesity is a byproduct of insulin resistance.
Wow.
So what happens is we get this cascading event of inflammation that leads to things like heart disease. We also get this erectile dysfunction that Trent had mentioned. And it becomes this vicious cycle of, how do I fix this? Where do I break this chain? Where do I break the cycle so that I can have normal testosterone function, normal masculine function, normal heart, your lower risk of cardiovascular disease and lower inflammation. And this is where we really kind of play our our main intervention is on it. Let's get rid of this metabolic syndrome in order to help.
Holy cow.
I wanted to cite just a couple of studies just to show that the research is out there. Ben, like Trent mentioned, I work with Ben Bickman very closely. Lots of studies that show that men with obesity, metabolic syndrome, type 2 diabetes have low testosterone, and men with low testosterone have metabolic syndrome and type 2 diabetes. They both lead to each other, which is a problem.
They are connected.
They also show in different studies that if you can find a way to lose the weight, which is also helping to improve insulin resistance and maintain that weight loss,
the dad bodies,
testosterone levels will improve, and they will remain and have a sustained increase in those levels by improving those things. Gone. And then last, I always like to point this out because this is independent of age. Sadly, we are seeing it. I see 20 and 30-year-old men all the time now who have low testosterone because they have insulin resistance. And so this doesn't just happen as we age. It can happen at any spectrum of the age span. And so we want to make sure that we're dealing with the insulin resistance, which is the primary factor we have control over. So a couple other things I wanted to touch on, because like women, we care about things like breast cancer. Men care about things like prostate cancer. But there is a difference between what we call BPH, which is benign prostatic hypertrophy or enlarged prostate, and cancer, and where insulin plays a role. For those of you who don't know, prostate is only found in men. It's located directly below the bladder, and it does tend to increase with age and or insulin resistance. This study, and I love to point out this number, look at the increased prevalence of prostate cancer in people with insulin resistance.
Holy cow.
If you have insulin resistance, you have a 250% increased risk of developing prostate cancer. So what do? Again, we want to tackle the root cause. Let's get the insulin resistance under control.
Holy cow.
For those of you who don't know Ben Bickman, this is his book called Why We Get Sick. I highly, highly recommend it. He cites in there multiple different resources or studies that have been done that shown that people with insulin resistance this is people with insulin resistance right here, have increased the number of insulin receptors on the cell compared to somebody without insulin resistance. The prostate is not insulin resistant in this person. We have more insulin receptors on the cell so we can get more glucose in. And because we know that glucose is the primary fuel for cancer, having more insulin receptors just means there's a lot more locks there that you can actually insert a key into and get more glucose in. Wow. So we want to reverse or reduce that level of insulin resistance.
Wow.
So let's talk about a few other factors that play a role. And we know that a lot of people come here because they want to talk about their weight, but I want to talk about the different kinds of weight gain that are out there. This slide I like because they label it correctly. There's a fat fit and then there's a fat unfit. And there's two very big differences here. In this one right here, you can see that there's a lot of subcutaneous fat deposition, meaning this is the stuff that you can grab with your hands and jiggle. That stuff is not harmful. That is not going to lead to insulin resistance. The kind of fat that leads to insulin resistance is the stuff that's inside of our abdominal cavity, which is called visceral fat. And visceral fat is well known to be the main problem with insulin resistance, low testosterone, poor cardiometabolic health, all of the above. When we can look at things like visceral fat, and this is where I do recommend, if you haven't done it or if you're concerned, and I always say this with men, if you can stand up straight and look down and you cannot see your toes, you have too much visceral fat. If you have to bend over to see your toes, you have too much visceral fat. You want to make sure that you have reduced that waist circumference, which is so prevalent. But this study really did go in and just show that visceral fat measurements really are the best predictor of metabolic risk factors out there, above and beyond all of the other, what they call anthropometric, things that we can actually measure with a measuring tape or a scale. Visceral fat is the number one predictor when it comes to metabolic health problems. This slide I really like too. They look at, as you can see up here in the top, at a variety of different markers that we're concerned with. What are your blood sugars? What are your triglycerides? What is your HDL? All of those things. And as you can see, there's a bit of a threshold. Right about here, when we get to about 10 centimeters or higher of visceral fat amount, and that's the number that we encourage at Insulin IQ, is to aim for below 10. Once you hit 10, you'll notice a couple of things start to rise. Initially, it's just these two, which are your triglycerides will go up and your HDL will go down. HDL is your healthy cholesterol. It's the one that we want to be high. So that combination, and we talk about it a lot here with the Feel Great system, that triglyceride to HDL ratio is a very important marker when it comes to overall metabolic health. So we see this problem right here happen a lot sooner than we see the rest of the problems, which are the high blood sugars, the other metabolic risk factors and whatnot that don't actually start to occur. Their threshold seems to be a little bit higher. So catching this at that 10 centimeters is really important in order to help prevent or reverse all the other things that can accumulate after the fact. I like this slide because I just think it really shows, again, all of these things are related. And that's the best thing and the worst thing about insulin resistance. If you have it, you're going to get most of these things. If you can reverse it, you're going to improve most of these things. And most of these, again, are related to men's health. So heart disease, loss of muscle tone, poor erectile function, things like that are the problem. But we can fix it with one or two simple interventions. And so I'm going to list them here and I'll go over them very, very briefly. What can you do?
Right?
First of all, we want to get insulin down. Follow an insulin lowering diet. These tend to be low carbohydrate, high protein, moderate fat style of diets. Incorporate the Feel Great system. It is a wonderful, wonderful tool in order to help you do those things that will lower insulin. Incorporate some intermittent fasting, which the Feel Great system also helps with. Focus on some weight loss, particularly that visceral fat weight loss. Incorporate some resistance training. You can boost testosterone by increasing muscle mass. Do other things to boost testosterone, and I'll touch on those briefly. And those will help you to prevent problems with the prostate, improve overall health, reduce diabetes, coronary artery disease, and the like. Some other things you can do, and just because I do like to practice in an integrative way, maximize your thyroid, make sure that you're following a low-carb diet. You know, maybe a gluten-free diet is indicated if there's autoimmunity there. Optimize your vitamin D. The more and more I see patients, the more important it is to make sure your vitamin D levels are optimized. Focus on things like sleep, exercise, stress management. Hormones, testosterone in particular, require cholesterol in order to be formed. If your doctor has you on a high-dose statin, you might want to have another conversation with them about trying to not lower that cholesterol too much so you can continue to make testosterone, and then consider different supplements or testosterone replacement or the like. And I always like to share this. People say, oh, I just want to grow old gracefully. Well, not me and not the people I love. I want them to fight it every battle, every step of the way. So do the things that you can to improve what we call health span, not just lifespan. We want to improve health span.
Love that term.
Improve all of these things, lower insulin levels, improve insulin resistance, consider some supplements or prescriptions, and make sure to find a well-versed provider when it comes to doing things in that realm, because there's a lot of nuance when it comes to boosting testosterone levels. And again, like Trent said, I always do a little plug for myself here at the end. You can find me at Venn Integrative Medicine or Insulin IQ.
Great
We do offer a
information.
10-day free membership at Insulin IQ, so check it out if you're interested. So quick and easy, Trent.
Okay, this is awesome, but Lindsay, I want to keep you here for a second because I wrote a couple questions down.
Hold on. Go.
And we may bring you back for the live Q&A here in a second, but I'm fascinated by a
Trying to
couple of
ask
these things.
throw
So
some questions at
you said something there at the end that if somebody's on a high dose of statin and they lower their LDL too aggressively, the body needs LDL to create testosterone. And so if you're suppressing LDL too much, you may also potentially decrease your testosterone.
Yep, cholesterol is absolutely mandatory in building testosterone. And so if you're driving LDL or cholesterol down, you are impairing your ability to make your own testosterone, unfortunately, as a secondary effect.
And I'm going to bring up a screen here because my next question requires a little bit of a drawing. And I want you to maybe coach me on if we've got this right. Because I actually, there's 47 million Americans now on these statin drugs for lowering LDL. But that may not always be desirable, is what I'm hearing. And this is my understanding, and I just want to check it with you. Let's use some different colors here. So my understanding is if we're looking at LDL, we have the large, fluffy particles that are neutral, if not beneficial to health. And we have these small, dense particles. And when looking at LDL, these are the bad guys. So we'd say these are the good guys, and these are the bad guys, right? And so when you go to your doctor and he tells you your LDL, maybe he says, hey, your LDL is, 190. This is dangerous, the doctor may say. And we have a lot of medical professionals on this call. We have so many wonderful medical professionals like you, Lindsay, that are a part of what we're doing. And so I'm a non-medical professional getting schooled here by somebody who's one of the best in the world. So
Right.
your LDL is high, and so you go on a statin because your LDL is high, or maybe that's what your doctor tells you to do. But what this number here doesn't really tell me is whether I have a lot of the good ones or a lot of the bad ones, right? And
Correct.
if I'm on the statin, and let's say the statin slashes this down to 50, which is very low LDL, right? For all we know, we might have killed off a bunch of these guys, which I needed for testosterone, and now my health is worse than it would otherwise be. Is that all accurate?
That's, yes, 100% accurate. Statins only work on the fluffy beach balls of LDL.
Okay. So what you just said is when you take a statin, it's not very effective at lowering the small dense. It's really effective at lowering these guys, which are the guys we want to keep around anyways. Is that right?
Correct. Yep, you are dead on.
Okay, amazing. Next thing, this visceral fat. My understanding is that this fat is the last in and first out. And this is good news because when we eat food too often that causes our blood sugar to spike and our insulin to spike, after our body fills up the areas that are supposed to get filled up, like our love handles, it says there's no more room in the love handles and starts to pack fat in right here in the visceral fat. So this is the fat surrounding our organs, our liver, right? Let's look at a healthy liver, and then we've got a fatty liver, right? But my understanding, Lindsay, is that the good news is that this is the first fat out. And as we do some of the things that you talked about, like doing some fasting and maybe low carb and so, getting rid of all of this excess carbohydrate, that this fat may be the first fat that we're able to lose. Is that accurate?
Yeah, the human body is very much wanting to protect itself, and it knows that visceral fat is harmful. So it will do everything it can to protect itself by last and taking it off first.
Okay, so with that in mind, we're going to talk a little bit about a protocol where whether you're man or woman. Oh, and there was one more question, Lindsay. But whether you're male or female, if you want to go really hard on your health for the next 60 to 90 days, and if you want to dramatically reduce your visceral fat, improve all your lipids, and just totally transform your life, we're going to talk about an aggressive, it's not that aggressive, but a protocol that could help you do that. So we're going to talk about that in a minute. I had to ask, though, when you were going through all this about men's health, what about women? How does
Whole other call.
testosterone
But-
affect women? If a woman is insulin resistant, what does that mean in terms of her testosterone, estrogen, progesterone, etc.?
Yeah, there's a lot of factors to play there, and especially depending on where you are, menopausal and all of those kinds of things. But extra testosterone is a good thing in women. So what creates our ability to actually accumulate more visceral fat is lack of estrogen. And so that's why men get more belly, more of the protruding belly than women actually do. But as we hit menopause, our estrogen goes down, as does our testosterone, which the testosterone can be a little bit more protective against those visceral fat scores like you saw in those studies. So it is for both men and women that it is beneficial.
Okay. Thank you for taking us to school, Lindsay Venn.
Awesome.
You are the best. Guys,
Thank you so much.
Lindsay, if you
We're
wouldn't
gonna
mind,
jump
maybe in the
off here.
comments, can you put how somebody would reach out to you? If you
That we're going to have to jump off. I'm going to have to go, but I just want to sit there and say, if you are interested in learning more about the protocol that Trent was talking about, and this is all about right down here. This is what insulin resistance looks like. These are some of the issues that Lindsay talked about. This is the QR code to use. You can check on our webpage. Would love to have you come on. I'm going to be talking more about the protocol to come, and we'll do this on some other lives. But thank you all so much for being here. As I always say, go get the day, make it golden. I hope this is helpful for you. If you are coming in and watching this later, make sure that you jump up and you check out, subscribe to our channel. Don't miss that out, because we're constantly doing more of these webinars. We'll have Lindsay back on along with some other medical professionals. Got some great things coming up. So thank y'all so much for being here. As I always say, go get the day, make it golden, go be excellent to one another.